the 2 zonal psychiatric hospital, it's not $1.78 billion that he's saying. We've given them a transition note. We've handed over. We discuss it. It is $1.4 billion, not 1.78 billion. So the $380 million, I don't know where he's getting it from. Maybe it was not well briefed or something. But if you remember, about 2 weeks ago, his spokesperson, Honorable Ofusu-Kwakye, even mentioned that we need, and I saw it captioned all over the place and distributed all in social media, that the government has to find 1.4 billion to complete Agenda 1. I think you all saw it.
Right.
Honorable Dr. Omadebo Amatu, when we met him as the President Committee on the Transition, he was one of the co-chair plus the former majority leader.
Right.
And then I think another NDC is now the Minister for Roads and Transport. We met them and then we discussed this thing at length, showed them where the money is coming from, what we are doing to make sure that we finish this Agenda 111. And we thought that by now they will still be commissioning a lot of that Agenda 111 because the processes for supply of equipment has been completed. The processes even and then we've sat down with the Ministry of Health, Ghana Health Service, who are the users, the number of people who are going to work in each of the hospitals. We know the numbers. So we are very, very much happy that we are going to have the nurses, the doctors, and all the people who are staying at home, especially our health professionals, pharmacists, a lot of batch of pharmacists who are at home, biomedical engineers, medical technologists, medical laboratory scientists, doctors, and the batch of nurses who are at home will all get places to go. And I've always been telling them that when we post you, please take up the position. And also thinking even about medical villages for the rural communities. So it's a well thought of project. So that's how it is. So it's not 1.78 billion or 1.7 billion. It's left with 1.4 billion. And it's done in such a way that the contractors go to work, prepare. There's a site supervising consultant. They prepare their certificates. It passes through their site supervising consultants. It comes to the coordinating consultant. It comes to the office of the president, and then the IPCs or interim payment certificates are sent to Health Gift, where the money is paid for.
Right. Let me be clear. The money had already been set aside. Was it now? Did it have to go through processes to get it still? You say that the money was available, or
no government.
We knew where the money was coming
from.
One
thing they should know: they have been in governance before. They've come. The NPP will come. They will come. NPP. They've come about 3 times: Rawlings' time, Atamel's Mahama time, and then now Mahama's time. So they know what governance is. No government looks for money, especially if it is our budgetary allocations and also from our own resources, and put the money in the Bank of Ghana waiting to be used. No. Agenda 1 was not like that. It's the same thing like any other projects which the government is funding.
Right.
It's from our own taxes. That's one of the sources. From the government budgetary allocation.
Right.
And the second one is from the oil revenue. There's something we call above budget formulary allocation, ABFA. Agenda 111, the Minister for Finance went to Parliament and asked in the budget that Agenda 111 gets 20% of the CAPEX of the oil money. So every time that oil is lifted, we get the 20% of the CAPEX.
Right.
In addition to what we negotiate with the Ministry of Finance and the Finance Select Committee
as normal part
as a normal budgetary allocation.
Right.
Sometimes that's why it's a bit late in coming and we don't get all. But because of what we are doing, lobbying here and there, we're able to get a lot of the money from it. In fact, if I'm not mistaken, we had over about 7.5 billion Ghana cedis alone from both sources. And that's what we'll be using. And we have plans how to even ring fence that money so that we can use all this money. And I can tell you that PIAC That's the PIAC is what? Public Interest Accountability Committee.
Yes.
They went to some of the sites of Agenda 111 and they came out and said that if they have their own, they would think that most of the money from the oil revenue should be used for Agenda 111 because it's a heritage project.
Right.
If you look at Kolebu was built 100 years ago, but we are all enjoying from it. Kofanoche 70 years ago, we are all enjoying from it. So if you build hospitals and it's well maintained and managed, our great-great-grandchildren will come and enjoy, if the oil is even not even there, some of the oil revenue that this country had. Like they are doing in Norway, they are doing in Dubai. Dubai is not, they don't now, there's no oil there again, but they are now getting the legacies from the oil revenue that they were invested. So it's a very good investment. And I'll say that health is not just a basic need, but health is an investment.
Doc, here's the thing. The president also mentioned the fact that only one of the proposed number of hospitals had actually been completed. I mean, in leaving your responsibilities as an advisor to the president, was that the situation when you left?
That also is not true. I don't know if it's lying, but that is not true. It's a lie, apparently. It's not true. You remember, on the December 5th, His Excellency President Akufo-Addo commissioned 3 hospitals, 1 virtually and 2 physically. The one that he cut the sword on the 18th of August 2021, that's the one at Xtra in Achimako-Angoma municipality, was commissioned in the morning. The time we were commissioning the Achimako-Angoma one, another one at Bokoro in Ahanta West in Western region was being commissioned by the regional minister. Right. The speech that the president read there was also carried live there. And then after the commissioning, we then went to Kokobe in Oforukro municipality behind KNUST and commissioned another 100-bed hospital there. And it's also not true that there was not even a chair there. All the beds, all the theater equipment, all the laboratory equipment are in the hospital. So there were very tiny things that the contractor was supposed to complete. And then they would then train the workers. Ghana Air Service would send staff there. They would train the staff on the equipment and then start working. In fact, if it was somebody's private hospital, you could have even started the following day and start using the outpatient department. Because what was left to be completed was the door. For example, in Xtra, the door to the theater, because it needs a special door which was ordered from South Africa or somewhere, and then also the cooling system, because they use negative pressure air conditioners in the theater so that there's be no infection. So there's something we call the chiller system, which was not there. In fact, if you go to Bokoro, they have their chillers and everything ready. But because we voted then on the December 2 days later, and the government, and then we lost power. The contractors also, they are also very funny people. They have to make sure that the next government will carry the project forward. But I'm sure from what happened yesterday, a few of them who are still on site, I'm sure will pack and leave. Because they have to wait and see what the next, because I've heard that they said also that the Minister for Health will come and present the way forward. But if you remember, this project was in the office of the president. It was the president's special initiative. Yeah. And I believe that is the way to go. But if that's they want to think about it otherwise, then it's the way to go. But I would say that, I mean, from yesterday, I became a bit alarmed that if you are not very careful, this noble idea, this very, it's a legacy. If you are not very careful, it will go to waste.
Are you concerned that because it's not going to be an NDC legacy, that is the reason why maybe it's being looked at like this?
Yeah, I think that should be a legacy. Yes, it's true that President Akufo-Addo's legacy, but it should be the pride of Ghana. That, to me, that's what it is. In fact, I was recently at Dubai. I met some Nigerian chief medical directors and all this, and when they got to know what we are doing here in this country about health, that we are building 111 hospitals across the country at the same time, and you want every district to have a first referral center? I say yes. So I took them through what we are doing. They were shocked. And I have the map of where all the hospitals are scattered throughout the country. Anybody who sees it said this is a very bold initiative.
Was it too ambitious?
Yeah, but governance, if you are not ambitious and you don't have a vision, you don't need to be in governance. Because even in the Bible, if you don't have vision, then you are dead. And if you are not ambitious and you want to do things as it was before, then why do you want to? So you should allow the same thing to continue. To me, ambition is also a very important aspect of good governance.
At the time that you were leaving office, would you have any sort of percentage numbers of levels of completion and where you'd say that the project, the larger project, was at the time of handing over?
At the time we were handing over, we have initiated 101 of the 104 district hospitals and the 2 psychiatric hospitals. So there were 2 zonal psychiatric hospitals, the one in Tamale and the one for the Northern Belt, and the one in Onwi in Musomchi Ajoso municipality for the Middle Belt. Have initiated. 30% of it, that's about 36 or 37 of them, were above 70% plus completion. If a hospital construction is above 70% completion, what it means is that it's almost near completion. And 3 of them were commissioned on the December 5th. Right. So the other 33 of them were all above. In fact, when I check in January, some of them are even now going above 80%. 26 of them were between 60 and 50, 70 and 50%, and then the rest were below 50%. There are a few of them which we have just started. For example, if you go to Dansoman, we had a land issue. We just got the land and it has been initiated. If you go to where again? If you go to Adesso had a problem with the topography, and we're trying to solve it. So these are the statistics that we have about the level of completion. And if you go around the country, which we have done, that's why I said that going forward as a country, I think there should be a special ministry or a special department which will take care of all these schools, hospitals, and other infrastructure. And then when they finish building it, they give it to the ministry who is going to who have the technical people to use it. That should be the way. Right. I don't believe that we should divide these things and share it. The minister will help build your hospitals. Going forward, from the experience that some of us have of Agenda 111, that to me should be the way forward.
You mentioned that you had the staffing available for a large number of these hospitals.
Yes.
In terms of at all levels, we're talking about technical to doctors, to everybody. Yes. You had available for.
Yes. We sat down with the users who are the Ministry of Health, Ghana Health Service, with their HR department, and then we work out the staffing norms. How many doctors, how many nurses, how many biochemistry staff, how many biomedical engineers, how many laborers, how many artisans, all the workers within a health system. So we knew the numbers. For example, the district hospitals would need about 550 workers at full capacity. The psychiatric hospital has 949, and then the regional hospital 1,350. We calculated how much their salaries will be and allowances. So we know the cost. We all look at it, we discuss it, accepted it, and presented it to the Ministry of Finance. So what was left for the Ministry of Finance was that as the hospitals are being completed and commissioned, we need to have financial clearance for this number of staff to go and work in these hospitals. So everything was set up. That is one of the reasons why Ministry of Health, Ghana Health Service, forced that they should start employing some of the nurses at home so that they prepare them for Agenda 111 and also the other hospitals. If you remember, this government, apart from Agenda 111, has completed about 47 projects that they initiated from the beginning to the end. Hospitals, right. The environment projects. 5 of them have been commissioned in the Ashanti region. There are about 4 of them or 5 of them also in the Greater Accra region, and then I think in the eastern region. I don't think if they are even functioning by now because they don't have the staff. They have to mop up the few nurses and few doctors within the system when there are a lot of them at home who are not working. Those who are given financial clearance through a process from July 2024. They went for the on the platform for the nurses, the 15,200. They went on the platform on August 4th to August 25th, 2004. And most of them were they finished, and then the Ghana Health Service, because they post throughout the country, started posting them in the various hospitals and in the regions.
Mm-hmm.
And most of them started work, I think, by December ending or early January. And all of a sudden, there's a revocation of all appointments. For what reason, nobody knows. To a extent that a letter then followed that even if you are working and you are not on payroll by the end of January, you are suspended if you go home. For what? Nurses who are already on duty, who have been put on roster, doctors who are put on roster and they're on duty, they should all go home. Is that the way you manage systems? No.
Have you had the chance to talk to anybody about this? I mean, there's some non-essential. I mean, every job is essential, I assume. But there's certain jobs that are more essential than others. Like with nurses and doctors who are in this particular situation. Have you been able to talk to anybody, have an argument with anybody and say, no, it cannot apply wholesale. But look at emergency services, look at certain personnel and say, no, obviously this is not political. This is because they're needed.
Luckily, I've heard that GRNA, Ghana Registered Nurses and Midwife Association, and the Ghana Medical Association have written to the minister. And I heard the minister, I think last week in Parliament, say it's a house of records, and he's setting the record straight that they have not asked anybody not to work. Anybody who had a financial clearance which ended on December 31st, 2024 will not be sacked. But I also saw another regional director issuing a letter to the various facilities that they should follow the directives from the original, from the boss.
The original letter.
So you don't know which one is which. But luckily, I think all the people who started work on January 1st, the association have asked them to stay put.
To not move.
So they shouldn't move. And I think they are working. And I hope nothing happens. The same thing with teachers. Teachers also go through a process. You see, people should know, when we've been saying it, some of us have been in this business for a long time. Recruitment in the public sector is a process. It's a structured process. Nobody is recruited without financial clearance. For example, for health professionals, nobody is recruited without going through proper registration of the regulatory body. Apparently, it's the regulatory bodies which send the names of those who have been registered by them and they are in good standing to the Ministry of Health for them to be sent to the Ministry of Finance. So there's nothing like we are going to vet it. They are qualified, because I think on Saturday I heard somebody saying that if you go and employ a doctor or a nurse and he's not qualified, that is not the case. And for heaven's sake, nobody goes for employment in this system using a party card. I haven't seen it before, because I was the Director General of Ghana Health Service. I was the Chief Executive of Konfanochi Teaching Hospital. Nobody comes and say that this is my party card, employ me. No. And they are employed in cohorts.
Right. So this batch.
Right. So this is the problem. So now, what I believe they should do, if they want to maybe bring people in, more people, because they want people to be employed, this is the time that all these hospitals which have started, which have been commissioned, which are not started working, they should employ more people to go and work, so that the Ghanaian youth will know that there's employment coming on. Yes. But you see, what pains me is that during the campaign period, I also heard the president saying that he will complete all Agenda 11 hospitals. Didn't you hear that? Several.
Yes, we did. We heard it.
So what has changed?
Well, has he actually said that he won't complete the hospitals? He's just talking about the funding requirements, or is that proposing to say he won't do it? Can he say he wouldn't do it?
You see, yesterday, if you listen to him very well, he didn't talk only about funding. He spoke about funding, and he spoke about something which is very intriguing, that competition with Christian Health Association
mission
hospitals in health. I will repeat it here once again. Health is not competition. Health is collaboration. That's the reason why when you go to Kolebu and you go and see a doctor, maybe you go and see your physician, and you have an eye problem. We all learned ophthalmology when we were medical students, but he won't tell you that because maybe I'm charging you, I want to also look at your eyes and give you treatment. It's never done. You go to UK, private hospitals are opposite each other. They are even in the same block. In Germany, where I know very well, they are in the same block. They designate a place that this is for primary care. So this is where the private hospitals are all. It's like going to market to buy tomatoes. They are selling opposite each other, next to each other. But when Nanaya goes to market, he knows where he's going to buy her tomatoes. It's quality. It's customer care. So we don't compete with mission hospitals. After all, the mission hospitals that he was appealing to, that they should come and maybe he doesn't have money. You know, the government pays all mission hospital professionals. So somebody that you pay, where is he going to get the money from? Even if he gets the money, is it that he's going to also compete against itself? And they should have given us one instance where, when he was saying that we are competing. So if you go to maybe Xtra, there's a mission hospital that they are competing. You go here, you are competing. He couldn't say it. There are mission hospitals where the towns where the mission hospital, for example, Agogo, Offenso, Boko, and all these things, they come to write to us, complaining to us that we should give them, you didn't give the agenda 111. So you should go there and tell the chiefs that the hospital here, we shouldn't have built it here. You see what the chiefs of the people will tell you. So it's a prelude to everything that is telling us that he doesn't have money. He doesn't know where to get the money from. The money is too much. And we are too ambitious. We're too ambitious. So if I don't do Agenda 111, just it's because of this. That's what I see. But we kept quiet to watch and see when the budget is read next month, at the early next month. We will have known if Agenda 111 is in the budget or not. That's where the time that we wanted to talk. In fact, today talking here, I was telling everybody that, you see, I haven't come here. I said that let's give them the honeymoon period. But he doesn't want the honeymoon period. So because they are trying to stimulate as I say that, these people, they won't say anything. And we can see something which is good. You don't condemn it. You don't just destroy it. And this is not the first time they are competing has come. One time, I think, with some foreign, ambassador to the US or something. If I meet the ambassador to US, what I will tell the person from foreign donors that we are doing Agenda 111, very important thing for us. There are some areas that people are interested in. Why can't you bring us some support for equipment? Because they will not put their money into building. So we are afraid that if Ghanaians are not careful, this good idea will go to naught.
But let me be clear, though. With the whole idea of the missions, and I understand what you said about they've come to the ministry and to health service for support, but they're fairly they have a good reputation. So if the president says, and I'm going to quote what he says, if the missions have a hospital in an area, we are not coming to compete with the missions by building a hospital. We will use the resources to improve the mission hospital so that they can provide the service. Do you have a problem with that?
We've been doing that. As we speak now, Ghana Health Service brought in some oxygen concentrators. They didn't give it only to their hospitals. They are giving also to the mission hospitals. They've given, I think, a number of them to, for example, St. Patrick Hospital in Offenso. Because they are collaborating with where government cannot go, they are there. In fact, first, they were in the most remote areas. That's the reason why, because I worked in the mission hospital before. When I was there, and I was a medical superintendent at St. Patrick Hospital Offenso, the only people who were paid by government were we, the doctors, and I think 2 or 3 nurses. The rest of the people, we have to work at the end of the day. That it was cash and carry to pay them. And we started negotiating through check. And government slowly have now absorbed all the workers. So when they are posting nurses and posting doctors, they also give a chunk of them
to
the mission hospital.
Right.
And that is a collaboration. And there are some other things, for example, maternal and child care, when there is any research money, when there is any some equipment. When COVID came,
right,
the equipment that we gave to hospitals, well, also some of them were given to mission hospital by the previous government. So that's what he said. It's already been done.
Right. So nothing new.
It's nothing new.
Right. But again, the proposed partnership. I don't want to push this, but I need clarity. He's talking about proposing a partnership with religious organizations and mission hospitals, allowing them to take charge of incomplete hospitals. Does that make sense to you?
I'm not too sure if allowing them to take over is maybe they bring in money. If that's the case, then you should make it even to private people, because there are some private people who are also prepared to also align and take charge.
Take over an Agenda 1.1 facility.
Yes, if I'm a private person now, and you said that there is also Agenda 1.1 here, can you look for funding to complete it? I will be able to do. I will do it. And then we come into agreement.
Would you want that? Would it be something that you'd encourage?
We were even thinking about even the management of the hospitals. That's the most important thing. Building a hospital is a different thing, but continuous management and continuous planned preventive maintenance. For example, if you go to Bank Hospital here,
okay.
It's being managed by private people.
Okay,
that's what I think. In some hospitals you should do. Even Kolebu. Why don't you give it a group of consortium of private people? Kolebu will be different. You put in extra resources and make sure that they can recoup their resources over a period of time. Somebody will say that the poor cannot go there. It's not true. Even the poor, now they can't even go to Kolebu very efficiently. Exactly. So it can be done. But as a government has started this project. If you believe that maybe government cannot get all the resources, but I'm showing them the source of resources. Even from oil funding alone, if they increase the percentage slightly from the 20% over 25%, they will get the necessary resources over a number of years. You can use that as a means of some banks paying the contractors up front and then collecting the money. It's possible. So that alone can do it. But you don't stop it and say that, missions go and look for money. What is the mission going to look for money for? Gone are the days where they were getting money from their big churches. Now it's no more there. A hospital construction is not a small money. Agenda 1.1 costs about plus the equipment, it's about 16 million. And there's one thing. Agenda 1.1 is one of the most cost-effective hospital construction in this country, because we used to, with external funding, hospitals were costing 38 million. The same type of hospital, district hospital. So, but this one is about 60 million. So, one hospital with funding that they were using before can build two hospitals plus a balance of 4 million.
Right. Now, let me talk about quality. Sometimes when you have too much, then you have less quality. Was there ever a challenge, and do you see a challenge or possibility of a challenge with the quality of care that you will get from having too many facilities and then sparse resource spread far and wide, especially if we don't have enough, even staffing?
The quality of care depends upon the staffing and the quality of staff who are working in the hospital. I believe that Ghana, we cannot say we don't have enough staffing, especially as we speak now. We have the 2020 nurses have been absorbed. You have 2021 nurses cohort. We have the 2022 nurses cohort, and the 2023 nurses cohort are just finished. I think they just finished their national service. So there are 3 cohorts. There are about 60,000 of them. Averagely about 15 to 20,000. We have some doctors who have also finished their 2-year national housemanship training who have not been absorbed. We need them, but it's because of government budgetary allocation for financing them. As for the doctors, I believe that we were thinking that it should be straightforward. They don't go through that long system. We have not employed or given financial clearance to pharmacists since I think 2021 or so. So there's a cohort of 2022, 2023, 2024, who are two. When I met them recently, before at somewhere when they have their list, they were also complaining.
So these youngsters are the ones who are forced to go and work in somebody else's pharmacy.
Yes,
whilst they're
some
waiting.
Of them working, and some of them are also waiting, and some of them are also left the country. We also have a cohort of medical laboratory scientists at home who are also not employed. The same thing of physician assistants. So all the government, and then the worst one is even the biomedical engineers that we need to continuously be maintaining the equipment in the hospital. We are not employing them. They are too. Some of them are doing their own thing. Some of them have gone to other countries to do consultancies and the rest. So that's not the problem. The problem maybe will be the top notch of maybe physicians. Like the specialists and this thing. But I believe strongly that, for example, a consultant surgeon like myself should not be a consultant in only one hospital.
Right.
If you go to UK, somebody is a consultant in the Children's Hospital. Here is another consultant in Chelsea Children's Hospital, and about 3 places. Because not every time that you'll be working at the place. And then they can also move with medical students and house officers and residents to these hospitals.
Okay.
So that we can have, I will be a consultant in Kolebu, but I'm also a consultant in Bank Hospital. So I have house officers in Bank Hospital, I have house officers in Kolebu, I have residents in Bank Hospital, I have some in Kolebu, and I have also people that I'm training, even medical students, also in Bank Hospital and also in Kolebu. And to me, if you do that, all these hospitals across will have people who are working there, and they are also supervising consultants who come there maybe once a week or twice a week, because they have their residents there. And now even medical students can also be decentralized, those doing clinical medicine. The most important thing, which limits the number of students that we admit for our health professional training schools, is the clinical training, because health profession training is both didactic and hands-on. The most important thing is even the hands-on. As for the didactic one, you can sit by your computer and read. And now because of webinar and then digital system, anybody can stay at any district and then join what is going on in the bigger places. Once you do that, the quality will be okay.
Okay.
So that's one. The next thing is they're also maintaining the equipment. And once we get the biomedical engineers who are well trained in this country, and we can even train more, they can continuously be also working on the equipment and everything, and it also be well maintained.
So the quality is available.
So quality is available.
Okay.
And we can make it available.
Right. Okay. Before I let you go then, final word, if anything that you want to share with us on what has been said by the current president and any concerns you think you want to raise.
Yeah, what I'll appeal to the government is that Agenda 111 is a heritage project. Agenda 111 should not be left to go rot. Agenda 111 should be continued and completed. If they want to listen to us, they should look at the oil funding. I know that there's a lot of competent things that the budget is looking for. But I would not hesitate, maybe I'm being biased, if you put money into the health of the people, you're not wasting that money. It's an investment. Because there's a huge investment in health.
And you mentioned also that there's a great opportunity for employment within these same
service. Yeah. And then apart from the direct professionals that you employ, even the indirect work that will happen. For example, if you go to Pasa, and I went to Pasa. Pasa is next door to Togo and also to Burkina Faso. And Asana, even the small polyclinic there, if you go to Paga and the rest, all the Bukambes come there for clinic. And if you go and see where the health center, which is at Paga, where they come to hospital, you'll be shocked. They call it hospital. So if Agenda 111, which is there, is finished, it means it will attract people from Burkina. And they will streamline that they come and pay hard cash. That is what we call medical tourism.
Medical tourism.
The same thing with all the hospitals along the borders. Once you do that, then the bigger hospitals where patients were coming to flood because there's no proper referral system, they don't know where to go. So they come and straight to Kolebu and there are no beds. Then they will concentrate in doing the training and also going into very sophisticated medical tourism system. And to me, that's the way to go. So any government who wants to improve the economy of this country have to look at health. And the way to look at health is to make sure that the people in the country are healthy, to make sure that you can also attract people from outside your shores to come in and access medical services in your country. For example, it's a lot of money going out from the African sub-Saharan Africa. For example, those women who go to do shaping and all this, you can do it easily in Kolebu at the plastic surgery unit. Why can't you do? Why can't our government hospitals do intravenous IVF? But it's always the private hospital, because all the people who matter, all the big consultants are in these teaching hospitals. Right. So government should concentrate on that, and you can only concentrate on that when you make the base strong, so that not everybody flop to the main hospital. And I will plead with His Excellency the President that he should look for every resource that he can to finish Agenda 111 as quickly as possible, so that Ghana will achieve quality universal health coverage before anybody. Because if you have the hospitals, it also improves or solves the problem of geographical accessibility, and then you strengthen the national health insurance, and then bring in even more private health insurance to work in the system, so that the financial accessibility is also solved. And then you strengthen the ambulance system, so that the pre-hospital care is also sorted out. Then you have hospitals everywhere. You strengthen the base where we are now, Ghana Health Service is doing what you call the network of practice, so that there's a network of practice, or the base. And Ghana has a very strong health system. We have about 5-tier system. We have the base, which is the chips. We have the sub-districts, which are the health centers. And then we have a very strong district health systems. And then we have the regional hospitals, which are the secondary system. And then the big boys, the Kolebu and the rest, which are the specialist system. Once you do that, everybody from Nigeria, from Togo, from everywhere will come to Ghana for health services. And we can then have direct foreign exchange into the country. We employ more people in the country. More people will be having other works to do in wherever these hospitals are. And then you can attract investors to very far away, very remote areas like Pasa, like Paga, like Adabukuru, like Xtra and the rest, because they know that there's health systems there. When their people are sick, they can put a factory there and then solve their problem so far as health is concerned. To me, that's my word for them. And then trying to just say that, what these people started is completely useless should not be the way. Governance is continuous.
Thank you very much. Good to have you as always, Dr. Anthony Nsiah-Asare.
Thank you.
Former Presidential Advisor on Health, and making an impassioned plea there, but also a passionate advocate for his chosen specialization in life, which is health. So, as always, great to have him here for his thoughts and insights. And thank you for your time.
Thank you.